Well, according to all my clocks, we're very close to 2 minutes after the hour. So hi, everyone. Welcome to a panel discussion on pathways to Medicaid expansion for non-expansion states. I'm Dick Needleman, a retired orthopedic surgeon and a member of Doctors for America. Before we get going, I want to take a quick minute to invite you to officially join Doctors for America. Did you know that being a DFA member today means taking an important and simple step of selecting one of 6 membership levels and paying your annual dues that are very important to support DFA's organization and sustainability? A DFA member will put a link to join in the chat. And did you know we're going to be live streaming to Facebook Live and recording our webinar, and all materials will be available afterwards. So I'd like to go over a few quick ground rules for this educational session. Number 1, there is no such thing as a stupid question. 2, we will address your questions after each of our panelists have a chance to speak about the role that they have in their non-expansion states. Although, if anyone has a pressing question, I have been assured that some of my panelists will allow me to interrupt them to ask your question. 3, the Q&A is open to everyone. Please enter your questions on the Q&A feature at the bottom of the display. And 4, look for comments in the chat section. Our staff will be sharing helpful links throughout the session. So before we begin our Advocacy Grand Rounds, I'd like to tell you about our speakers. We are fortunate to have panelists from North Carolina and South Dakota, 2 non-expansion states, with us today. Peg O'Connell is the chair of Care for Carolina, a coalition of 146 organizations committed to finding a North Carolina solution for closing the health insurance coverage gap. She has over 25 years of experience in legislative, public, regulatory, and governmental affairs. In addition to healthcare, media, and grassroots advocacy at the state and federal levels. She has been active in North Carolina, working to enhance public health by improving access to healthcare and reducing the prevalence of smoking and obesity. An attorney by profession, Peg has spent most of her career in government affairs and communications. She graduated magna cum laude from Marietta College, earning a BA in history and political science, and received her law degree from the Ohio State University College of Law. Zach Marcus is the campaign manager for South Dakotans Decide Healthcare, an organization that sponsors Constitutional Amendment D, called the Medicaid Expansion Initiative, which is on the ballot in South Dakota on November 8th. He has been managing political campaigns around the country for the last 10 years. And he is excited about the opportunity to make meaningful direct change by expanding Medicaid in South Dakota. So let's get going with our panelists. First up will be Peg. You're on mute.
Thank you. I just didn't want you to hear my cat meowing. Hello, everybody. Thank you so much for asking me to do this. Dr. Needleman, Marlu, Angie, thank you. And I'm excited to meet Zach and hear what he's doing in South Dakota, which is sadly an opportunity we do not have in North Carolina to actually have citizens amend our Constitution. So next slide, please. So the Care for Carolina, Dick already told you. Dick, since I gave you that bio, we have gotten 2 more organizations to join with us, and the most recent being the Episcopal Diocese of Eastern North Carolina. So next slide, please. this is just a representation of some of the groups that belong to Care for Carolina. We're not a coalition of individual people, although we have about 2,000 signer honors, but we are an organization of organizations. So these are just a general representation, but we have voluntary health care advocates for patients. We have professional societies, including the Medical Society, the Academy, also all the specialties, the medical societies in North Carolina, the Nurses Association, the Public Health Association. So a broad variety of people who are interested in health policy, and economic development, as well as advocates for children and parents. Next slide, please. So just to back up a little bit and kind of set the stage, the Affordable Care Act was passed in 2010. In June of 2012, the United States Supreme Court, while upholding the Affordable Care Act, struck down the mandate for states to expand Medicaid to cover people up to 138% of the poverty level. The plan was for the Affordable Care Marketplace to come down to 138%, Medicaid to come up to 138% of poverty. However, when the Medicaid mandate was struck down, it created what we call in North Carolina the coverage gap. And while all this was before the courts, the North Carolina General Assembly actually passed a law prohibiting the governor from expanding Medicaid, indicating that they would be the only ones that could do it. In the past, an expansion of Medicaid coverage would be an administrative or an executive action. Next slide. So this is just a representation of what the coverage gap looks like. You can go on now, Marlo. So I think many of you know the problem is people who make too much to qualify for Medicaid or are ineligible otherwise, which in North Carolina is a single man or a single woman. And they make too little to get a subsidy on the marketplace. Again, they don't make above 138% of the poverty level. A majority of the people who are in this gap are working. They don't have employer-based health insurance where they are. And you can see some of the folks who are stuck in this gap. And I'll give you a bigger picture of that in a little bit. But these are the people who are our neighbors and our friends, and a lot of the people who kept our economy going during the pandemic. Next slide. So how does the coverage gap happen? And I would say for Zach, these numbers are pretty similar. An individual gets nothing. If you're a mom with one child, if you make above $7,200 a year, you're not eligible for Medicaid, and you have to make up to $17,000 a year to be able to get a subsidy on the marketplace. So you're in the coverage gap. Next slide. So this is just a demonstration of how a mom who wants to work, is working, can fall into the coverage gap. Looking at if a person works 40 hours a week, and those of us who know these folks know that most people who are working at minimum wage are working way more than 40 hours a week. But this is a mom who has a child to care for. Her 40-hour-a-week job takes her not even close to the $17,000 she needs to get a subsidy on the marketplace. Next slide. So we know 76% of adults eligible for Medicaid in North Carolina are working people. And again, these are the people who kept our economy going during the pandemic. Next slide. So just so you can see who these people are that we're talking about, we have 600,000 of them in North Carolina. Again, this is just an indication of where they come from. And the interesting thing is, look at the bottom box where it talks about healthcare and social assistance. During the pandemic, the largest group of uninsured workers were nursing home assistants. In the environment that was really the most difficult environment, perhaps other than the hospital environment, for people to work. And if they got sick, they had no health insurance. Next slide. So this is North Carolina specific data, but we wanted you to see what we were hearing for a long time. Well, let them just go and buy private health insurance. Let them go to Blue Cross or United. This is what it costs to actually buy health insurance in Wayne County. Now, Wayne County is the home of Seymour Johnson Air Force Base. It's in the eastern part of our state. Look at the cost of this. If you're making $13,000 a year, are you going to spend your money this way? You're probably going to buy food. So going to the private market is just not a possibility for folks like this. Next slide. So one of the things that Dr. Needleman asked me to talk about is the strategy we're using. So you'd heard me talk about the coverage gap. For a long, long time, it was political suicide to say the words Medicaid expansion in North Carolina. That is just now changing. I've been working on this for 8.5 years. So we talk about closing the coverage gap. But so why do we want to close the coverage gap? Well, the federal government has promised 90% federal match indefinitely. It's in the law. I'd like to say in perpetuity. It's part of the Social Security Act. You would have to have an act of Congress to actually change that. Also, right now, I think one of the reasons Zach and I are encouraged is there's a bonus on the table. New expansion states that come on, the last 12 non-expansion states could pick up an extra 5% match. So that means the federal government would match 95% of the cost. And that would mean that almost $2 billion, $1.7 billion would come to the state of North Carolina, which could be used for anything. Could offset the cost of expansion, but it could also be used for tax cuts, capital improvements, whatever we determine. Next slide. So this is, yes.
Can I interrupt you? I got a burning question on the chat and I was looking somewhere else, but
okay.
You know, a member of our audience is very impressed with how you were able to cite a statistic of some of the demographics of people in the coverage gap. And the citation is 76% of the people in the coverage gap in North Carolina are working. Well, that's pretty impressive. Could you maybe embellish this for people who are here today?
Certainly. So we have been working through the good offices of the Cone Health Foundation, for those of you who might be from the Greensboro area. And they have done over time a couple of economic studies, and the economic studies talk about who's working, who's not, what's the economic impact of Medicaid expansion on the state, what's the economic impact of not doing it. And so the combination, the economists, the smart people, working with our Department of Health and Human Services and our Unemployment Services Office have developed that figure for us. So I didn't just make it up. All right. So
thank you very much.
Very good. So closing the gap. So this is for I saw a couple people here are from North Carolina. For the longest period of time, the main impediment to closing the coverage gap to Medicaid expansion was one person, and he takes ownership of this. He is the President Pro Tem of the Senate, Phil Berger. He's from Rockingham County, which is up on the Virginia line. In the past, he would be no way, no how, hell no. 2 weeks ago, he was on the floor of the Senate saying that exactly this. If there's any other person who has spoken against expanding Medicaid more than I have, I would like to meet that person. But now I know it's the right thing to do, and it's not even close. So based on new information, based on all the incentives that are on the table coming from the federal government, based that his being convinced that the money the federal government has promised is not going to go away, Senator Berger has changed his mind. And that is an amazing thing. So last week, a bill containing Medicaid expansion and some other things passed the Senate of North Carolina, and they have sent that package over to the House. So now we focus our efforts in the House now. So this is this is as close as we have ever been. Next slide. So these are just largely to give you an indication of how popular expanding Medicaid actually is in North Carolina among voters, because that's what legislators care about. It is popular among Republican voters. It is popular among the general voters. So the concerns I think many had of the political liability are starting to abate. Next slide. So also, because I know one of the issues for DFA is the issue of mental health, it's also the issues of substance abuse. We estimate, based on, again, smart people working with our Department of Health and Human Services, that 150 people with mental illness and substance use disorders could get access to affordable care, affordable health care. Next slide. And again, just another slide on mental illness, and we can move through this. But I think those of you who are physicians, you know the drill on this. Next slide. So again, we are struggling with a horrible opioid epidemic in North Carolina. And we saw it skyrocket again during the pandemic. So one of the things that is really important to all of us is to get people who struggle with substance abuse, behavioral health, and mental health issues treatment. If you don't have insurance, treatment is haphazard at best. So, and you can see the numbers here. Next slide. This is personal to me. My husband's a veteran. So this slide actually needs to be updated now. It's 14,000 veterans in North Carolina. We're the home of Cherry Point Naval Air Station, Camp Lejeune, Seymour Johnson, and Fort Bragg. And we have so many veterans mustering out of the Army, and they stay here. But when they leave the military, they lose their health insurance. They may not have gotten jobs yet, or they're working at lower income jobs. We find that there's a huge number of veterans in this coverage gap. And this is an important issue. This is part of the strategy, messaging to people who care about veterans to help them help us change this policy we have in North Carolina. And, sadly, we have one of the highest uninsured rates for our veterans in the country, even though we call ourselves a military-friendly state. Next slide. This is just a recent slide that we got from the VFW coming about Iraq and Afghanistan veterans. I remember the Vietnam War, and I know what it did to mostly the soldiers who came back. That same thing is happening again. Next slide. So this is just, we know that there will be a tremendous economic boon to North Carolina as far as money coming in, jobs created. And I know that's not really the main focus for a physician group, but about half the jobs that will come from the, bringing in money and people spending money, hospitals being able to keep their doors open, about half the jobs that'll be created. And again, this is from an economic model done by a genius at Georgetown University, will be in healthcare. And that's something that's definitely necessary in North Carolina. Next slide. So we know they're working, and a lot of them are in healthcare and social assistance. What we have now is it's better from a health insurance perspective to not work at all, so you can get and keep Medicaid if you're a parent. And we're experiencing a terrible labor shortage in North Carolina. So our labor commissioner, Josh Dobson, says he is fully in support of Medicaid expansion. And he's actually coming to a prayer breakfast next week to talk about it. Next slide. So, And then as physicians, you all know, when people aren't well, they're not as productive. It's businesses struggle. Also, just the burden, oops, I'm supposed to stop talking now. The burden of chronic disease in our state is tremendous. Sadly, North Carolina always ends up in the list of some of the sickest states for chronic disease. Next slide. All right, so where do we go from here? The bill has passed the Senate. Our next steps are in the House. And this is a very high level negotiation, way above my pay grade. I've been working on this for 8.5 years, but now it is getting serious discussion in North Carolina. And a little bit of prayer can go a long way and because I used to say, if we were going to get this done, it was going to take a miracle. And it's at least partially where that miracle has happened. That's next slide. All right, that's me. Thank you.
Peg, that was great. You know, if anybody out there is from North Carolina, stay tuned. I think we're up for South Dakota right now, and Zach's coming off his a high from a very important thing that happened in South Dakota just the other day.
Yeah, thanks, Dick, and thanks to Peg for talking through so many of the details so that many of my slides will now be irrelevant since you just saw much of it. But really glad to be with you all today. As Dick referenced, Tuesday evening, we got the results of in the primary election. There was something called Amendment C on the ballot. And what that would have done would be to raise the threshold for ballot initiatives and constitutional amendments that either raise taxes or expend more than $10 million, which Medicaid expansion would do. And if passed, Amendment C would have required those to meet a 60% threshold rather than a 50% plus one threshold. I'm pleased to announce that with nearly 70% of the vote, that was defeated. So that's all good news. Next slide, please, Marlo. Next slide again. One more. Yeah, so some of these slides might be quite familiar to you. Many of the organizations that PEG works with in North Carolina are also active here. But I think one thing that as a ballot initiative, as we try to talk to voters around the state of South Dakota, it's really important to us to have trusted messengers, right? We can have anyone who wants to call someone and say, hey, we really would like you to support this, but it's really important that we have someone from the local community, someone who people know be the one communicating. So as we think about who that might be, whether it's local elected officials, whether it's business leaders from the community, whether it's members of advocacy groups that people know, I think that that's just such a crucial part of this. So as we think about our partners with AARP South Dakota or the American Cancer Society Cancer Action Network folks here in South Dakota, or any of the other numerous groups within our coalition, it's always important to think about who are some of our advocates and providers in certain communities so that we can think about who the best voices will be. And then, of course, grateful to the health systems here in South Dakota who are a big part of our efforts. Next slide, please, Marlo. And next slide again. So we talk about this a little bit, and this is the presentation we give here in South Dakota. We're trying to explain to voters why this is important, but Peg covered a lot of this. So much of this you're seeing again. Next slide, please. This is something that's really important that we talk about all the time here in South Dakota. I'm sure Peg does in North Carolina as well, but one of the concerns we always hear is how we're going to pay for these things, right? And the fact that the additional 5% increase is coming is a huge benefit. And actually, with this additional 5% increase, the Legislative Research Council in their fiscal note for our program attests to the fact that the state will actually save $63 million over the first 2 years of our program. And that's something that I think is going to be really important for us as we're telling this story. Next slide, please. And the next slide again. Ballot initiatives. South Dakota is one state that allows them, and I think that it's a really cool opportunity to allow the people to weigh in directly, and I think that's an important thing. South Dakota is actually the first state in the union to allow ballot initiatives, which something that folks here take great pride in. But a very challenging effort, I will tell you, to ensure that you can access the ballot. We collected just over 46,000 signatures in order to make sure we had enough. That process was finished up on November 8th and took us, for any of you who have been around campaign people before, it took about 2 months for Secretary of State to validate our signatures, in which I was, as you might notice from my photo in the camera here, was pulling out my hair through most of those 2 months. But we did access the ballot, and we're really proud to be able to put this before the voters in November. So next slide, please. And next slide again. So, I mean, this is sort of what we're telling people about, right? And something that I think is a really clear case to make. And it's a real benefit that we have so many different kinds of groups as part of our coalition, because not every organization has the same incentives and reasons to support Medicaid expansion, right? So as we think about who the 42,500 South Dakotans are in the coverage gap, there are many of these folks who are suffering from diseases. So our partners at the Diabetes Association, Leukemia Lymphoma Society, and other groups can really talk about how being in the coverage gap is so damaging when you're trying to pay for insulin, especially. I know that's something that many folks in South Dakota and around the country can sort of understand and appreciate. So many of us know folks with diabetes and understand how expensive insulin is, right? And this is part of the story we're telling. You know, obviously, as we think about the cost factors here, millions and millions of dollars returning to South Dakota that have been allowed to be taken, but have not been taken over the last 10 years, right? So over the first 5 years of the program, $1.3 billion coming back from taxes that we've paid that are going to be coming back into our state. So obviously a huge argument point there. Many of the most of the folks in the coverage gap here in South Dakota are in rural areas. Lots of people in South Dakota are in rural areas, so that makes sense. But the farther away from a hospital you are, or from a community health center, the more difficult it is to access care. And the more uninsured patients in a coverage area like that, the more difficult it is for folks to keep their doors open, making it just that much more difficult to access healthcare in the future. So something really important there. And then obviously, Peg talked a little bit about the economic impact, but money flowing into the state is part of it for businesses as well. But also, it's so important for businesses to have healthy employees. People who are able to access health insurance tend to miss fewer days of work, tend to have fewer complications. So it's just important all the way around. Next slide, please. So you saw the slides from Peg a little bit earlier, but thinking about the what it really means to make $18,000 a year, that's not a lot of money. And if you're needing to buy health insurance coverage without subsidies, it's a really hard decision for you to make with all of your other costs for food, for lodging, for clothing. Just becomes a really, really difficult proposition. Next slide, please. So we talked about this a little bit earlier, but $1.3 billion coming back to the state, and actually a net savings over the first 2 years. I think that's just sort of says it all for anyone. Setting aside how important it is to get people health coverage, this is huge, huge, huge amounts of money for our state's budget, and that's really important. And for folks here in South Dakota, never a bad thing to get a dig in at some blue states while we're in the opportunity. So that's something that we tend to highlight as well. Next slide, please. Again, we talked about this a little bit earlier, but uninsured South Dakotans are more likely to be rural, and rural residents are more likely to have difficulty accessing healthcare coverage to begin with before we even get into issues of insurance, right? So really, really important thing there. Next slide, please. And then, I think we all know small business owners who would love nothing more than to provide healthcare coverage for their employees, right? But it's expensive to set up group plans. It may not be with a possibility within their business model. So we have to figure out another way, and Medicaid expansion can be that option. And I think that will be a good thing for our state. And then as we start to think about, thousands and thousands of dollars that are lost every year to medical debt, this is a way that money can be coming back into stores and shops here in South Dakota and keep businesses open. So very important. Next slide, please. So we encourage anyone who's interested to get involved, take a look at our website, or I'm sure my contact information will be somewhere within this chat at some point. So anyone who's interested in having conversations about this campaign, we'd love to have you.
That was great, Zach. And Peg. Well, we're done with the presentations. And if you give me a few minutes, I'd like to thank you both for showing us that 2 different non-expansion states had 2 different pathways to try to achieve expanding Medicaid. The neat thing about this conference for the physicians who are here is I'm sure many of the people here know a lot about the frustrations of their own particular states with Medicaid expansion, but I would hazard a guess that many physicians probably don't. And at least this educational seminar gives us an opportunity to bring those physicians who don't understand some of the nuances of a non-expansion state and how there are different pathways, such as there are in North Carolina and South Dakota. And I suspect that the other 10 non-expansion states have their own pathways of achieving this too. The one similarity I see between both of you, both of the states and both your organizations, is how you build coalitions. I mean, 148 coalitions, organizations in North Dakota. And I don't remember how many were in Zach's group, but I filled up a slide. I mean, I didn't see any weight. All I saw were organizations that were involved to try to get Medicaid expansion in South Dakota. So I see that the coalition building is very important for each state. And I'm not exactly sure how many people are here, but I see people from different states. I noted people from North Carolina. I don't know if I saw people from South Dakota. I saw one incensed physician from Wisconsin who I suspect would really like Medicaid expansion in Wisconsin. So trying to get doctors together, galvanize them, bring the energy together in a positive way in order to try to achieve this, I think is why we're all here. And one thing maybe I didn't learn in medical school, but I suspect that Zach and Peg are helping us with is the messaging. How do you tell your stories? And the doctors are really good at stories because politicians like hearing their stories and other people like hearing their stories. So doctors are good at telling stories, but I think it's the rest of the messaging that would be very important for us to get help on. And the other thing, and the last thing I wanted to talk about before getting to the questions was barriers. I mean, I'm seeing things in the chat, and I suspect maybe they should be in the Q&A, but I'm seeing that in North Dakota, one incensed physician is upset about the Speaker of the House because Peg referred to this as that the bill passed the Senate and now it's in the House, but now the barrier is in the House. And then Zach referred to the fact that since you can have an initiative in South Dakota, which you can't have in North Carolina, I don't see I don't see it as a barrier, but having an election in November 8th means that people are going to vote for it, but then people are going to vote against it. And I guess if you have too many people voting against it, that's a barrier too. So understanding the barriers, I think, would be very important in getting Medicaid expansion through. So it is time for questions because I can't speak anymore. I'm seeing questions on the chat, but I suspect there are questions on the question and answer thing, but I don't see any there. So I might have to go to the chat to pick out questions. So let's see. Peg, did you want to discuss strategy to try to move Tim Moore and his Republican colleagues in the House?
Yes, so where we are is so there's a couple of things going on. In the past, again, I've mentioned I've been working on this for 8 years. So 4 years ago, the House was ready to pass a Medicaid expansion bill designed by a Republican legislator. And it unfortunately got caught up in a budget fight with the governor. We have two chambers of our legislature, both controlled by Republicans. Our governor is a Democrat. That's a gentleman named Roy Cooper. So we were very, very close in the House. So this weird flip where now the Senate is the proponent of doing this is it's a little surreal. But in order to move the speaker, Tim Moore, who's from Shelby, which is west of Charlotte in a quasi-rural area, a number of things are happening. So one, Senator Berger has committed to doing everything within his power. And for those of you who are from North Carolina, you know that is substantial, to convince the speaker that this is the right thing to do and this is the right time to do it. The governor has been working in the same fashion. And in something, again, I thought I'd never see, you have the governor and the Republican leader of the Senate working together to try to convince the speaker. So you've got that at a very high level. The other thing that we are doing is our 148 members, some of whom have lots of money, some of whom have very little money, have been deploying grassroots and grass tops. So grassroots are the everyday folks. Grass tops might be the business owner, might be a chamber leader, doctors. We always put in the grass tops category to start messaging their legislators. Speaker Moore keeps saying now's not the time. In all honesty, if this isn't the time, I don't know when it's going to come. But he also keeps saying, I'm not hearing from the members of my caucus that they want to do that. Well, we're working on getting messaging in, and we're starting phone banking on Monday to make the members of the Republican caucus say, Mr. Speaker, everybody is calling me about this. Everybody is writing me. There are ads in the newspaper. We need to get this done. So that's going on. There are conservatives for Medicaid expansion who are running polls in key House districts to demonstrate, in swing districts, to demonstrate that the support for this issue could make the difference in a Republican winning a swing election. So we're doing all of that at the same time. And the members of the Senate are talking with their House members, saying now's the time to get this done. So it's literally a full court press toward the members of the House as well as the Speaker himself.
Well, that sounds great. I would like to take the moderator's prerogative and ask one question myself briefly to Peg, in alignment with what you had just said. There is a study commission for Medicare expansion, which was both branches of the General Assembly, and it was heavy in Republicans. So does messaging or grassroots reach the Republican House members of the study commission? Do they have any more influence on their colleagues?
In a lot of ways, the study committee enabled us to start talking about this in a more direct way. And for those of you who have worked in public health, the study committee helped to normalize the ideas around Medicaid expansion. They were trying to normalize things about advanced practice nurses and other things like that as well. But So that study committee was very beneficial. That's where this year's focus started. And to actually, that was the one salvage we were able to make out of last year's legislative debacle, where this we were thinking we would include Medicaid expansion in the budget at the end of the year. And because of the speaker's resistance, it did not happen. So, but those members are the most informed, and they're using what they've learned to move the issue forward.
Great. Well, we're gonna pick on Zach now. I'm still looking at the chat, although I do see that there are some questions in the Q&A. But here's one in the chat. Zach, have the chambers of commerce in South Dakota signed on to the coalition? And if the ballot initiative succeeds, are there any ways that the legislature could muck things up in implementation?
Both good questions. So first, to the Chamber of Commerce piece, I would say we have a strong working relationship there. They have been mainly focused on the fight against Amendment C until Tuesday, and now I expect that we'll see some more out of them moving forward, but that's really been the focus of the Chambers of Commerce up until now. Obviously, this is a very important reason to oppose Amendment C, but there are numerous reasons why other voters might have other reasons to do so as well. So they've been mainly focused on that fight. And as far as the second part of the question, so we deliberately chose to go the route of a constitutional amendment as opposed to a initiated measure, which would have meant requiring fewer signatures, would have gone into state statute as opposed to into the Constitution. And your question is why we chose to go down this road, is because we thought it was more difficult for there to be implementation difficulties if we place this in the Constitution.
Well, that sounds great. I do have a question, although I don't know who can answer this question. But I'm going to ask it just because I'm going to be democratic about things. Someone in the audience is very interested in Wisconsin and Medicaid expansion. And I know South Dakota is closer to Wisconsin than North Carolina. So this might be a question for Zach, although this might be a question for no one. Does anyone here know what can be done or what is done to expand Medicaid in Wisconsin, despite the Republican legislature that is opposed to it?
Yeah, unfortunately, I wouldn't care to speculate on that matter. I am more than happy to discuss Medicaid expansion options here in South Dakota, of which I pay a great deal of attention, but unfortunately, I am not familiar with things in Wisconsin.
So Dick, if I may add something, when we did this, the prep call for this, there is something moving, hopefully, at the federal level that could provide some help, temporary help to non-expansion states. And we've been able to use that here in North Carolina to message that if the state does not act, the federal government is going to do it to us. And what they actually would do is simply buy insurance for everyone who is in the coverage gap on the marketplace. So they would not expand Medicaid. What happens there is the state doesn't get the signing bonus. The state doesn't get the enhanced match. They simply, it just is a federal pass-through, and the state loses all control. And the health plans lose all control. So that messaging, and I don't know what the political circumstances are in Wisconsin other than what I read in the newspaper, but that message could resonate to perhaps get things going. And there's a lot of money on the table from the American Rescue Plan.
Well, that sounds like a very good answer. I would just say to the individual who wrote the question, Mark Shields, I don't know what the law is there, but maybe they can have either a referendum or an initiative in Wisconsin that can circumvent the legislature like some of the other states were able to pursue. But I'm not familiar with how Wisconsin works. You know, one of our members, who I know from working in different committees with him, had worked on Medicaid expansion in Utah. And I guess it took at least 7 years to work through Utah because he said he worked on it 7 years. But perhaps in the remaining time, Peg and Zach can take turns, and maybe you can give an elevator pitch for how this can be pursued in the next few months in North Carolina and South Dakota. So Peg, you go first. What can you do in the next few months in North Carolina?
Well, we're going to be doing it. The elevator pitch is the federal government is offering us an enhanced Medicaid match. They are offering us $1.7 billion to get back some of the money that we, just like Zach, send to California and New York from every person's paycheck to cover the 600,000 people who are have no access to affordable health insurance in our state. And then we go, these are our farmers, our fishermen, our volunteer firefighters. So we try to make it real for them. I mean, some will never care, but there's long been a perception, a mistaken perception, that the people in the coverage gap and anybody associated with Medicaid is lazy, doesn't want to work, always waiting for somebody to hand them something. And the statistics, I mean, those of us who know people are on Medicaid, the statistics just don't bear that out. But making it real and then having one of those real people make a call following up, write an op-ed, write a letter to the editor.
Well, Zach, you have a little bit more time to get this passed by November, because in North Carolina, every even year is called a short session, which is sometimes over in July. So Zach, you probably have a few more words to say about how to get this passed in South Dakota than Peg does.
Well, you know, I think the goal with any campaign, which is slightly different than working with legislators who tend to have lots of questions about implementation and the details. When you're thinking about a campaign, you really want to keep things at a high level, right? Because especially when you're asking people to vote yes for something, you want it to be simple. You want it to be easily understood, because confusion is a big problem for a yes vote, right? If anyone is confused, they'll just vote no and figure we'll deal with it later. So we want to keep it really simple and keep it to exactly what we want voters to know, which is really two things. One, 1.3 billion of our tax dollars coming back to our state. And what we're going to do with that money is provide affordable healthcare coverage to 42,000 of our friends and neighbors who are falling through the coverage gap, right? Who are doing everything right, who are working hard, but still falling through the cracks. And that's how we're going to make this work. We're going to connect those two pieces of information together in a way that's really compelling. And I think that that is, you know, how everyone across the country should be thinking about this, because that's what we're trying to do here.
You know, and Dr. Newman, but if I can follow up, I mean, one of the things about being the last is we can look to see what's happened to the first. And the programs in almost every state have been nothing but a success. And I will quote the governor of my home state, John Kasich, who's no one can ever question his conservative credentials. He pushed this through. And if anybody's ever met John Kasich, you know what a powerful personality he is. Through his absolute will and cajoling and twisting of arms. But he actually spoke to a legislative hearing here in North Carolina. And he said, and I think this really affected even some of the hardest hearts and the hardest heads. When he came into office in Ohio, it was a rough time for Ohio financially. And he wanted to balance the budget. That was his promise. And then this Medicaid expansion issue presented itself. And he was like, we're going to get Medicaid expansion. We're going to do this. And somebody said to him, well, I thought you wanted to balance the budget first. And he said, and it makes me tear up every time I say it. When I die and I hopefully go to heaven, St. Peter is not going to ask me, what did I do to balance the budget of the state of Ohio? But he will ask me, what did you do for the least of your brethren? And you could have heard a pin drop in that room. And at the end of the day, at the bottom line, whatever cliche you want, that's what this is really all about. People who just need a hand up. And I think that at the end of the day, that is the flag that they will all wrap themselves in.
Well, Peg, you sound like a doctor, or maybe that governor from Ohio sounds like a doctor. We have a member of the audience who I've also worked in many committees with through Doctors for America in the past year or so. But I think he knows a lot more about financing than I do, because he wanted to ask a question. Maybe this is for Peg, but then again, Zach can chime in. I heard that Peg referred about the extra 5% from the ARP. Now, is it only good for 2 years, or is it indefinitely?
So, Zach, do you want to talk about that? Because I've been doing a lot of talking.
No problem. Yeah, it's good for 2 years from when a state accepts Medicaid expansion. So just to clarify on this point, it's not, if a state doesn't do it this year, that money goes away, but it is, I guess theoretically there could be some point in which it goes away if the law is changed, but it's good for 2 years from when a state accepts the expansion.
I hope that answers the question. Now, are there any other questions coming through? I'm checking the Q&A. I'll check the chat to see if any questions snuck through. I think the only question was the same as the other. Two people asked the same question. The 2-year timeline starts once it's accepted or once it's implemented, or is there a difference? Was that just answered?
It wasn't, but it's from implementation, I believe.
Okay.
So, Dr. Needleman, if I could add one other thing, I know we're getting close to time.
Yeah.
So during the pandemic, a lot of people went on and stayed and have been able to stay on Medicaid because of the federal government's already been giving a pandemic boost to the Medicaid match. What's going to happen pretty soon, come the 1st of July in North Carolina, and Zach, I don't know if this is the case in South Dakota, a couple hundred people could fall off the Medicaid rolls. So there's like a cataclysm coming if we don't do something. And that's one of the things that makes this so urgent. You could all of a sudden add a whole pile of new people to the uninsured population.
So that's the warning we have for both this state and maybe the 10 additional states who are non-expansion states too. Well, you know, we've discussed a lot of very important points. I know I always come better educated having gone to these sessions, and I became much smarter preparing for this session too. So I would like to close today's event by thanking our panelists, Peg and Zach, for a very thought-provoking discussion. We are so grateful that you were able to participate and educate us. Everyone can learn more about Medicaid expansion efforts in North Carolina and South Dakota. You can visit the Peg's careforcarolina.com site and Zach's SouthDakotansDecide.org site. Now, we're really not done, because all DFA members from North Carolina, if they're already here, are invited to join Peg and myself on Monday, June 13th at 7:30 p.m. because we're going to develop an action plan to expand Medicaid in our state. DFA has earmarked North Carolina as one of its top 3 priority Medicaid expansion states. and has dedicated resources to help with this project. And as you might know, a strong bipartisan majority of North Carolinians want to expand Medicaid to improve the physical and financial health of low-income persons in the state. And I know Mary Lou's here. She can tell you how to register. Please check the chat. For the others who aren't from North Carolina, please consider joining DFA's Medicaid Expansion Action Team, which I just found out about last night. If you live in a state that has not yet expanded Medicaid, or you're experienced with this work, we need your help because we want to grow this nationwide network of doctors as advocates to inform and educate policymakers and collaborative partners about the importance of Medicaid expansion. A DFA team member will put the link in the chat. So keep looking in that chat so that you can join this important work. I also wanted to share a couple of quick reminders.
Dick, I don't know if you can hear us, but you have frozen.
Dick, are you able to hear us? I don't think so. So I will just run through the last few reminders. So this event will be available for viewing later on DFA's YouTube channel. So stay tuned there. We would love it if you could take 2 minutes to complete our survey so we learn more from you all about what went really well today and what sessions you might like to see in the future. And you'll find the survey link in the chat. I'm going to drop it right now. It's a quick survey. Please just take a moment to fill that out. And thank you for being here and for all you do on behalf of patients. We hope you will become an official DFA member today and take a look at the benefits of membership on DFA's website. The #1 reason doctors, medical students, and health advocates join Doctors for America is to be with like-minded people that share the same values and priorities. Please remember to follow us on Twitter, LinkedIn, and Facebook and stay up to date about all of the Doctors for America programs, events, and ways to stay engaged. Thank you all so much for joining us today, and thank you to our wonderful panelists. I hope you have a wonderful rest of your day, and we'll see you soon. Bye, everyone.